Good morning, Gillian.
Good morning, Kay.
We are here to talk about endometriosis. So probably the best starting place is just what is it and what causes it?
Endometriosis is a puzzling condition. It's found in probably about 20% of women to some extent, but it's only really severe in a small proportion. A lot of women who appear with a diagnosis of infertility turn out to have endometriosis. Endometriosis is a condition in which the lining of the womb, the endometrium, grows in the wrong place. It should stay within the womb, but in women with endometriosis, it appears as little dots and spots throughout their pelvis, and it causes pain, irregular bleeding, and unfortunately, sub-fertility.
And how common is it?
Probably about 20% of women have endometriosis to some extent. And we know that for people who need fertility treatment, we find it probably in as many as 1 in 3.
Oh, so it's a leading cause of infertility?
Yes, often associated with other factors of sub-fertility. Mother Nature's quite good at making a baby if there's only one fertility problem, but as soon as there's more than one problem, and certainly including endometriosis as a problem, then it becomes progressively harder for a couple to achieve a family without help.
And does it run in families?
There is a fairly strong genetic link, and certainly one of the explanations for the genetic basis of endometriosis is a deficiency in the immune system. One of the causes of endometriosis, we think, is called retrograde menstruation, and that's when the blood and glandular cells that are lost every time we have a period track back up the fallopian tubes. And we think this happens in most women, but in women with endometriosis, their immune system doesn't seem to be very good at clearing away this menstrual debris that's in the wrong place. And as a result, these little cells implant onto the lining of the pelvis, the peritoneum, and start to grow. And so whenever the woman has a period, these dots and spots of endometrium that are in the wrong place also swell and bleed, and then that causes scarring and adhesions. And in severe cases, it can cause big cysts on the ovaries themselves, and that obviously is going to compromise the chance of getting pregnant naturally.
It sounds as if there are a number of complications. And does it cause a lot of pain all the time or only during menstruation?
For women with really severe endometriosis, they can have chronic pelvic pain. One of the problems is that endometriosis is quite a difficult diagnosis to make. It can only really be made with 100% accuracy by doing a laparoscopy. And one of the problems is that there are so many other causes of pelvic pain that it often isn't considered early enough. It's reckoned that most women have had symptoms of endometriosis for about 6 or 7 years before the definitive diagnosis is made. And of course, quite a lot of damage can have been done during that time. So it really is important, I think particularly at general practitioner level, for doctors to be aware that a young woman who complains of pain during periods, bleeding between periods, pain with intercourse, all these sorts of things that people don't like to talk about, actually they do need to be asked these questions directly, because if it's endometriosis, the sooner it's diagnosed and treatment is started, the better the outcome.
And what is the treatment?
There are lots of different treatments, none of which are 100% perfect. There are surgical treatments using keyhole surgery, laparoscopy. Then we can laser away these little deposits of endometrium that are in the wrong place. And if it's fairly mild endometriosis, that's a very good treatment. If it's more severe endometriosis with big chocolate cysts, as they're called, on the ovaries, then that may need more significant surgery. There are hormonal treatments which suppress the production of the endometrium by either inducing a pseudo-pregnancy, a pretend pregnancy state, or a pseudo-menopause, a pretend reversible menopause state. Because one of the things that was realised very early on is that women with endometriosis who do succeed in getting pregnant often have very much less severe symptoms after the baby's born, because of course during the whole 9 months they've been pregnant, they've not been having periods. So one of the earliest types of hormonal management of endometriosis was to try and fool the woman's body into thinking she was pregnant. So that's why the oral contraceptive pill is actually quite useful. The Mirena coil, which contains progestogens, is also another pregnancy hormone which suppresses the development of the lining of the womb. There are also some testosterone-based hormonal treatments which again suppress the lining of the womb and suppress the endometriosis. But the side effect profiles of the different hormonal treatments vary, and often it's a matter of trying different ones to find the one that suits you best. The pretend menopause treatments are very effective, but they can't be used indefinitely because it would cause all the other problems of the menopause, like osteoporosis. So what we sometimes do is try and suppress the endometriosis for a few months with one of the effective pretend menopause treatments called GnRH agonists, and then after 3 months the woman's been period-free and pain-free, and then we could stop the treatment for a little while and then start it again. Of course, the important thing to remember is that if the woman is trying to get pregnant, all of these hormonal treatments are going to act as contraceptives. So again, it's really important for women to explain to their GP or their gynecologist what their intentions are about babies, because sometimes the best way of suppressing the pain of endometriosis is going to be the very worst way to help the couple have a baby.
And if they have a baby, is it only temporarily suppressed, or does it actually help the condition for the long term?
It is only a temporary suppression, really, because particularly for women who have a aggressive type of endometriosis, then it will come back again quite soon after the pregnancy has ended. But we have seen with some of our patients with very severe endometriosis that it's taken IVF for them to achieve a first pregnancy, and then they phone up a few months later and say, oh, we're thinking that we might come and try for a second baby, but my periods haven't come back. And I said, well, have you done a pregnancy test? And they say, oh, don't be ridiculous, doctor. It took IVF for us to achieve our first pregnancy. And I said, well, that first baby may well have cured your endometriosis long enough to help you have a sibling, and which is lovely, of course.
And that is what happens. Amazing. As long as they wanted one quickly.
Well, yes, I think that's the trouble, that couples who've struggled to have a first baby tend to forget about contraception. Young women spend their 20s terrified they're going to be pregnant when they don't want to be, and are quite surprised to discover how difficult it can be to get pregnant when you actually do want a baby.
But I suppose anybody who's been through IVF is going to be happy to have any other babies that come their way.
Yes.
Do you want to take a break?